Hello, you guys. This is Shamika, your chronic care management nurse practitioner. And today, let's talk about STDs, sexually transmitted diseases. STDs are a serious public health issue that affect millions of Americans every year. And because STDs sometimes don't present with symptoms, people don't even know that they're walking around with a sexually transmitted disease. So it's imperative that if you're having sexual relations with multiple partners, or if you know that your partner is having sexual relations with multiple people, you protect yourself by using condoms, by effective condoms, use protection to make sure that you're not passing the disease along to someone else. I want to tell you a little story. Some years ago, I worked at a free clinic, and a lady came in with her boyfriend to get her test results. And she asked if she can come in the room by herself, in the exam room by herself, to receive her results. And yeah, of course you can. That's your right to privacy. So yeah, she comes in the room and she tested positive for gonorrhea. I was working with another nurse practitioner and he gave her test results and she was like, "Oh no, please don't tell my boyfriend. He might K me. He's gonna K me." And we were like, the guy was like, the nurse practitioner was like, "We have to tell him. We need to bring him in and test him too, because we need to treat him too. And we have to report it to the Department of Public Health so we can stop the spread." And she was like, "Oh no," she was having a fit. And at that moment, I knew in my head, and I'll never forget this. I said, she's been out there cheating on him, having sex with other people and putting his life at risk. So the situation was handled diplomatically, but that's just an example of putting other people's lives at risk without their informed consent. Even in research, you can't even do research on a patient without getting their informed consent, without letting them know that we're doing research. You need to, if you're going to be having sex with multiple people, you need to let the person know and let them make the decision whether they want to engage in a relationship that's going to include other people or not, because you're putting their life at risk for harm. So let's talk about some STDs and the STDs that most affect men. But I'm going to give you some symptoms of STDs that you can look for just in case there's something out there. The Center for Disease Control and Prevention encourages everyone to get tested regularly to ensure their health and safety and the health and safety of the public. When penile symptoms do occur, they can include pain and burning upon urination, a need to urinate more frequently. We kind of talked about frequent urination during the night. So a need to urinate more frequently, pain during ejaculation, abnormal discharge from the penis, particularly colored like yellow or green, or foul smelling discharge, bumps, blisters, or sores on the penis or genitals. Some common STDs in men are chlamydia is one. It includes pain upon urination, pain in the lower abdomen, and penile discharge. Remember, you're looking for any penis discharge, particularly yellow or greenish. In 2018, over 600,000 American men tested positive for chlamydia. And keep in mind, chlamydia sometimes don't present with symptoms. So you don't even know you have it for months at a time. Experts believe this is why so many cases go unreported. Chlamydia is treated with antibiotics. Take your full course of antibiotics, even if after the third day it seems like the symptoms have went away. If you have 7 days, then you need to take the full 7 days of antibiotics. Next, we're going to talk about genital herpes, and we're talking about STDs that are common among men. Genital herpes include itching and pain, tiny fluid-filled blisters or red-colored bumps, and ulcers that may eventually leave scabs. In 2016, 12% of the people in the United States had genital herpes. And keep in mind, It's possible to transmit herpes even if you don't have sores or symptoms. You can still pass it. It's still possible to pass it. Herpes is a virus, so it's treated with antiviral medication like acyclovir. Treat the outbreaks. There's no current treatment for herpes. We just treat the outbreak with the antiviral medications. Next is genital warts or HPV, human papillomavirus. Symptoms include small areas of swelling around the penis. In the case of the genital warts, it's like a cauliflower-shaped wart, and it's itching around the penis. Around 45% of men in the United States currently have HPV. And ladies, if you're listening, HPV leads to vaginal cancer. HPV leads to vaginal cancer. 79 million Americans overall have genital warts. Genital warts are usually treated with the medication that's applied directly to the wart, or it could be surgically removed if the medication doesn't work. Again, HPV leads to vaginal cancer. The next is gonorrhea. Symptoms include burning during urination, yellow or green discharge, and pain in the testicles. In 2018, over 350,000 reported cases of gonorrhea were here, right, in America, in the United States. And keep in mind, if gonorrhea is left untreated, then it can put you at high risk for HIV. Gonorrhea is usually treated with the regimen of 2 medications or dual therapy, and it's an injection in the muscle and the buttocks, and it hurts really bad. I've seen it given, and people complain of pain. The next is HIV. Symptoms include fever, rash, sore throat, and swollen lymph nodes. Symptoms worsen as HIV progresses. Over 1.2 million people in the United States are currently living with HIV. Keep in mind, HIV is thought to occur more frequently in men who engage in sex with other men because of the additional risk of transmission from anal sex. HIV isn't curable, but it can be treated by several classes of drugs that stop the virus from copying itself and taking over the body cells. So it's not curable, but we all know that. But there's a lot of medication, a lot of research have went into making HIV non-lethal. Next, we're going to talk about trichomonas. Symptoms are rare, but they can include itching on the penis, painful urination, and penile discharge. Trichomonas affects 3.7 million people in the United States currently. Keep in mind, around 20% of people with trich acquire it again within 3 months of being treated. And a lot of times that's because you're having sex with those same people that have it, and they probably haven't been treated. That's why it was so important to let that boyfriend know that your girlfriend tested positive for gonorrhea and she has to be treated, and we need to treat you too. It's so important that if you test positive for any of these STDs that you let your partner know so they can get tested too, because if not, you're essentially taking the medication for nothing. You're going to have to take it again because they're going to reinfect you, So STDs can affect anyone who's sexually active, regardless of their age, race, or sexual orientation. It don't matter. However, many STDs are highly preventable. Abstinence is the only foul-proof method to protect against STDs. However, by being aware of changes in your body and practicing safer sex, you can protect yourself and your partners. Consistently using condoms and other barrier methods makes transmission less likely. If you experience any of the above stated symptoms, please go to your primary care provider for treatment. Stop the spread. Thank you, And the information for this video was brought to you by an article I read on Healthline, May 2023. I'm Shamika Carter, your chronic care management nurse practitioner, and have a great day. Peace.